Hi, my name is Carrie Daniel with Gate College System, and I'm here today with Dr. Julie Morris, and we're doing a series of trainings on learning differences for college-bound teens. First, though, I'd like to just start with the term learning differences. I know that there's a lot of different terms that are thrown around, so can you just speak to what is the appropriate term that we should be using?
Well, certainly we all have learning differences. We all have strengths, we all have challenges, we all learn differently. So I think in general conversation, the term learning difference can really refer to anybody. For the purpose of requesting accommodations, whether in high school or college or on standardized tests, it would have to be considered a learning disability. Because a disability is something that substantially limits a major life activity, and that's what would necessitate an accommodation. When we talk about disability, a disability has to be documented in order for a student to request an accommodation, because an accommodation is based on the need to level the playing field because of a disability which substantially limits a major life activity. In this case, that would be learning. So for the purpose of requesting accommodations, we refer to a learning disability. Technically, the diagnostic manual refers to learning disabilities actually as learning disorders. So that's more for the purpose of diagnosing and documenting by the medical professional. The term disorder is primarily used for the purpose of diagnosing. In the medical or the diagnostic manual, the term specific learning disorder is what's used. However, that's primarily for the purpose of the treatment provider, the person that's actually documenting the disability.
And what types of learning differences lead to the need for accommodations on standardized tests?
Well, there are a wide range of disabilities. So in terms of learning disabilities, a student can have a learning disability in the area of reading, based on reading fluency, reading rate, reading decoding, reading comprehension. They can have a disability in the area of written expression relating to spelling, relating to the ability to express their ideas in writing. Students can have a learning disability in the area of math. They also may have attention deficit hyperactivity disorder. That's another diagnosis that is considered as one that might require academic accommodations. Some students may have a processing deficit. There could be a concussion that affects learning in some way. There may be another condition, such as a psychological condition, depression, that affects cognitive functioning. Autism spectrum disorder may require some accommodations. I should say at this point that test anxiety, which is one concern that a lot of parents and students do have, is not by itself considered a disability. So should there be a concern about test anxiety, the focus there should be on finding strategies to reduce that anxiety.
And if a parent and a student suspect some sort of learning difference, when should they start to look into that?
That is a really important topic because in terms of requesting accommodations for a standardized test such as the SAT or the ACT or AP exams, the people who review that documentation want to see a history. So if there's any concern about a student's learning early on, it's best to really try to identify what's going on early, as opposed to finding ways around it until they hit a wall. So I'd say the majority of students that I actually see for evaluations come to me when they're preparing for an SAT or ACT and don't have enough time to finish, because whatever strategies they've used up to that point are no longer working. Maybe they've gone to teachers who've informally accommodated them. Maybe they've had extra tutoring. But when it comes to taking that standardized test that has very rigid rules with regard to timing, then the student is not able to compensate. So I think if a student can get identified or evaluate what's going on early on, that's really going to be the best way for them to receive accommodations throughout their education.
And do the SAT and ACT require any certain type of documentation related to a learning difference? Is there a time frame that they look for?
The SAT and ACT both expect that a student has been receiving accommodations in school. And so there is paperwork for the school to complete that will verify that they have been receiving accommodations. For the purpose of the College Board, which puts out the SAT, a student has to have been receiving accommodations for at least 4 months. Otherwise, the school official cannot sign off on the paperwork. However, a student is welcome to submit documentation on their own, but if they're not receiving the accommodations in school, the testing agency is going to assume that a student has been able to function without the accommodations and therefore is likely to deny the request.
Right. And so where can a student go to get tested for a learning difference? What are the first steps?
Well, if a student is in public school, it's a little tricky because the school typically will not test a student unless they're achieving 2 grade levels below what is expected. So as a parent can make a request at any point in time for what is typically called an SST, Student Success Team meeting, at which point they can express their concern. There will be teacher input, and a determination will be made as to whether testing will be done by the school district. Alternatively, a student may have to get tested outside of school and then request a 504 plan through the school, which essentially means that the school would evaluate the outside testing and approve or not approve accommodations. The outside testing can be quite costly. There are places that might do it on a sliding scale basis, lower fee. Health insurance may cover at least a portion of it. Certain disabilities, if it's a psychological disability, for example, the College Board and the ACT may not require as comprehensive an evaluation. It might be more of a history and understanding what the limitations are from the psychiatric condition.
And so say a student does test and finds out that he or she has a learning difference, what kind of accommodations can be put in place when it comes to standardized tests? So there's a lot of accommodations that can be requested, particularly at the college level. For standardized tests, the more commonly requested accommodations would include extended time, such as 50% more time per section. Occasionally, they will approve 100% more time. Rarely, but on some occasion, they may approve a reader if there's a substantial limitation to reading. A computer can be requested if there's an issue with writing, in some cases with spell check for the writing portion of the exam. A private testing environment so that a student can read out loud, reduce distractions, get up and stretch if they need to. On the ACT, there's an option, at least currently, where a student can take the test over a period of time so that if they have an issue, say, with attention, they can take a limited number of sections per day over a period of time. And can you just speak to any common misperceptions about this entire process that you've encountered? I think there's a misperception that parents hear that there's an option for extended time and assume that if they get their child tested, their child will then be eligible for extended time. And it doesn't necessarily work like that. The report and the results of the testing have to meet certain documentation requirements and then have to be reviewed by the College Board. And they are pretty strict about what they're looking for. Sometimes it feels like there's no rhyme or reason. But one of the most critical pieces is a history of either a history of a disability that can be documented from early on, even if there was no formal testing, and or a history of accommodations, preferably from early on. So I think the biggest misperception is the assumption that a student can get accommodations if they've been tested. Thank you so much, Julie. It was great to have you today. And that's it for now from GATE, but we'll see you next time.